I'm going to take a few minutes to share some tips with everybody on trying to determine how big your facility size should be. There are a lot of people that give us a call every day and ask us that question. It's one of the first places, of course, that we start when we design a building is just trying to figure out how big it should be. So whether you're a vet starting out for the first time or whether you are a veterinarian who's actually been in an existing practice and is looking to expand, it's always important to try to figure out exactly what your square footage should be and what is going to work for you for the future of your growth of your practice. So out of all the things that we talk about and discuss with our clients, I think this is one of the most important things. There are usually about four different areas that come into play when we're thinking about this. One, of course, is the budget. What can you actually afford to build? And I'll talk in a minute about construction costs that we're seeing across the country and give you some general thoughts on that. The second important thing is just trying to figure out what sets you apart from the rest of the veterinarians out there. What is different about your practice compared to others, and how can we help figure out what sizes you need for that part of your practice. The other thing is just the facility type. Specialty practice versus rehab facility versus general practice, of course, plays into how large your facility should be. And then what your wish list is. Are there certain dreams that you have down the road, things that you want to build into the building that we should also factor into determining the size. And also, last but not least, the site. We're talking about a leasehold building, or are we talking about freestanding building? Are you in an urban setting, or are you out in the country? And looking at what your site constraints are. That has a pretty good effect on what you can build. So a couple rules of thumb in determining size of your practice are looking at the number of exam rooms that you need. So what we've found over the years is that usually you can figure out if you have one doctor practice usually needs 2 to 2.5 exam rooms per that one doctor. So as a general rule of thumb, again, 2 exam rooms per one doctor. So you can kind of use that as a multiplier to get you in the right realm. And usually it's about 1,000 to 1,500 square feet per exam room that you figure out. So you have a 2 doctor practice, that means 4 exam rooms. 4 exam rooms means 4,000 square feet at the minimum for that practice. So that's just a starting point. The other is, like I said, the site. And usually, if you figure out the size of your building, you need the site to be about 4 to 5 times the size of your building. So again, if you have a 4,000 square foot building, you're looking at a 20,000 square foot site. And that will allow enough space to actually have parking and any other site utilities and things like that you need to bring in. So just as a rule of thumb, those are some really good numbers to keep in mind. The other side of it, like I said, is of course the budget. Overall, we see a variety of numbers across the country. We work in all sorts of states, and I would say on average a freestanding building is somewhere around the $225 to $260 a square foot range for construction cost. A leasehold space is usually around $125 to $140, $150 a square foot, and the renovation of an existing building, depending on, of course, the details of that building, what are you working with in terms of existing mechanical systems, electrical, structural, usually it's around $130 a square foot. Now, of course, this can vary across the country. Of course, East Coast, West Coast are going to be a little bit higher than they are in the middle of the country, and places like Hawaii, of course, are going to be higher as well, just due to normal costs of shipping and things like that. So good things to keep in mind.